Dean's Living TV 2.0 coming to you. Let's talk about if you're an adult and you have a loose tooth. I have it's a side tooth towards the back, and I'm in median. I really don't want my teeth falling out, but I used to do like heavy Oxycontin. I was in a 5-car pileup. I was in pain management. Oh God, more years than I care to admit. 25 years addicted, and then I've been sober. I've been sober about 11 years. And tonight, I had a tooth break. Well, actually, the tooth broke a while back. But tonight, that tooth, it's loose and it's throbbing. And I have a modeling gig in the morning. I'm going, oh my gosh, I can't take opiates because I'm sober for 12 years. My mouth is on fire. I have to be on a runway at 10 o'clock in the morning until 3. And then I'm going to have to get an emergency dentist. And y'all... it's crazy when you have teeth problems, you know. Teeth can make you very sick. You can get an infection and get septic. So it's very important to take care of your teeth. So if you have a loose adult tooth, what could cause it and possibly what can be done to fix it? So I want to give a shout out to Mascario and Martini Dentistry. I guess they made this. Dr. Martini did this article. I always want to give credit where credit's due. But when, you know, you were a kid, you always got excited because you knew the tooth fairy's coming. But when you're an adult, you're like, my teeth are supposed to be permanent. What is going on? So, what causes adult teeth to become loose? Is there a way to prevent it from falling out? You know, I'm a big believer. I'm a naturopath, life coach. I believe that your teeth, the root systems in your teeth are all attached to your cranial nerves and your brain and your immune system, and your teeth really are your immune system, your gut and your teeth. So I really don't want to lose this tooth. So I'm going to try to go save it. And I was just kind of Googling ways to, you know, the dentist might be, or if the dentist could save it. I almost just like pulled it. And a part of me is like, no, you don't need to do that. So having a loose permanent tooth can actually be a common problem. It can be saved. Sometimes if you have a wiggly tooth, go to an experienced dentist. But generally speaking, teeth just don't fall out. There's got to be some kind of, you know, factors that, like poor dental hygiene, periodontal disease, stress too. So what can cause a loose adult tooth? So there's a lot of internal and external factors can lead. Common causes, poor dental hygiene, any type of trauma. Dental trauma due to a fall, a sports injury, or like an accident. Like I had my tooth break. This broke about probably a year ago, and I just haven't had the money. I honestly have had mold in the house. I had my car wreck, flood in the house. It's been one spiritual attack after the other. So I'm trying to save this tooth. Some traumatic injuries may heal on their own. I do a lot of oil pulling. I've been spraying thieves spray up in there, trying to see if I can't you know, kill any pathogens. Clove is really good when you have tooth problems. I'm 10 years sober, actually 11 years sober now. I can't use, you know, I can't do any type of opiates or anything for oral pain. And oral pain is the worst. Gum disease. If your tooth has become loose, seemingly out of nowhere, you likely periodontitis is a cause. More commonly, it's gum disease. It's when a bacterial infection wears away at the gums, the soft tissue, and bone surrounding your teeth. But as this disease progresses, it can cause your gums to kind of recede and your permanent teeth to become loose. So other symptoms of advanced gum disease is bad breath. I always know in gingivitis or someone's got, you know, periodontal disease, their breath will knock you over. I had a pharmaceutical rep, and I just thought to myself, oh my goodness, I wonder how bad the doctors kind of are repelled. I almost said something to the girl, and I was like, no, it's not my place. I'm just going to leave it alone. But I would want somebody to tell me if I had breath that would just knock you down. Your periodontal disease, when you floss, your gums that are swollen and sensitive to the touch. Stress can make your teeth loose. And I know I've been under amazingly stressed. I just got T-boned, house flooded for like, I don't even know how many times now. Guys, I'm a whistleblower, and they're attacking my life. Like on all aspects. You just would not, the noise, the light harassment, everything. That kind of stress, it will make your teeth loose. And a lot of times when you're under stress, you know, you're in fight or flight, you grind your teeth. And that can also make your teeth loose. pregnancy and menopause. When your hormones are off and your hormones change, higher levels of estrogen and progesterone during pregnancy can cause like your ligaments and bones in the jaw to loosen. But these changes are only temporary. During menopause, which is me, the opposite happens. The body starts to produce less estrogen. Yeah, I've got like 1%. I really need to go get on some like hormone support. But yeah, you can get cancer if you don't do that. So what, do you already have cancer? I don't know. I'm being funny, y'all. Which can, this can lead to bone density loss, and jaw bone becomes weaker and increases in the risk of loose teeth. Yeah, they tell me I had cancer, and I'm not believing. I'm not giving it authority. Cancer, I do believe, guys, is parasites. It's parasites and worms. And if you get pH balance, if you're not being radio waved and microwaved to death, like I am being a whistleblower, you can heal cancer. Okay, medications and underlying conditions. You've probably heard that calcium builds strong bones, but it's important for strong teeth. But medications like anti-seizure medications, it makes it really hard for the body to absorb the calcium. And then medications are taken over a long time. Like I was on medication for 25 years. It destroyed my teeth. Many common medications like contraceptives. All you women on contraceptives, antidepressants, taking your Prozac and all that crap that's poison, killing your brain, changing your brain. Dry mouth is another potential side effect which can increase risk of tooth decay. My mother had extremely dry mouth because of her medicines. If you suspect that your medication is the cause of your loose adult teeth, don't stop taking it. You need to go consult with your doctor first. You should never, and I repeat, ever, ever, ever just stop taking medicines. Certain underlying health conditions can also increase your risk of developing gum disease, a common cause of loose teeth, HIV, cancer. Well, that just tells me everything I need to know. Arthritis, diabetes, and osteoporosis. When is a loose adult tooth an emergency? Ideally, you should schedule an examination with your dentist ASAP. If left alone, the condition can gradually worsen and cause damage to the root and gums and can lead to infection. Contact your dentist immediately if you notice any of the following symptoms: extreme toothache, bingo, sores on your tongue or lips, changes in your shape or color or swelling of the gums. My tooth turned black. Bleeding gums when you bite or when you press your gums. Any type of pus in the mouth, you've got an infection, guys. Darkened tooth enamel. There you go. Got it. Unnatural tooth mobility or numb tooth. Inconsistent headaches. I've been having a lot of headaches. Did not even think about the tooth. Treatment. And I do not treat, cure, prevent, cure, manage disease or teeth. I am reading and educating. Treatment options. Depending on the severity, I understand that they can use non-surgical like splinting. I do know that. Where they splint, bonding the loose tooth surrounding the teeth to help secure it. That's a little temporary fix, and it will let the composite bonding. It doesn't last very long. You could also do a deep cleaning. If the tooth is loose due to poor dental hygiene or gum disease, the dentist may try to save the tooth through the means of deep cleaning. During a deep cleaning, a dental hygienist will remove the infection that's grown into the gum line, causing the gums to recede. And once the infection is cleared, there's a pretty good possibility that your gums probably can heal and tighten up around the tooth. Surgical treatments, they can do tissue and bone grafting, involve synthetic or natural bone placement around the weakened root to help regenerate new bone and gum tissue. But this procedure is common when periodontal disease is present. It weakens the bond surrounding that diseased gum. You can also do like this flap surgery. It's done to eliminate the calculus that is accumulated in the gum's deep pockets. It makes cleaning easier when you do this. It's a procedure in a person's gum. It's lifted to remove the tartar and then repositioned back in place. If it all goes well, procedure success, your gums have a tight fit around your teeth. Guided tissue regeneration, your GTR. This surgical procedure adopts a use of barrier membranes and encourages tissue regeneration where they were destroyed by periodontitis. The tooth cannot be saved, maybe need to be extracted and replaced with a dental implant. How do you prevent a loose adult tooth? Practice really good oral hygiene. Go to professional cleaning every 6 months and avoid tobacco products. Smoking and chewing tobacco, one of the leading causes of gum disease in the U.S. You also, cutting out tobacco can reduce your risk of both gum disease and oral cancer. I tell people all the time to stop dipping. You're going to have mouth disease. I've seen some, I saw when I was doing a preceptorship when I was in pharmaceuticals, I actually went in with a surgeon and saw a complete jaw replacement with a mammal jaw. I mean, I saw, he got a hammer out, y'all, and just whammed it. I was like, oh, I might be fainting now. I didn't, but I saw it. It was all because this cancerous growth, like the side, his whole jaw was eaten. It's because he dipped. He went quit dipping. Take steps if you grind your teeth, get a splint. Talk to your dentist about a night guard. Wear a mouth guard when you play sports, and stay hydrated. Again, that dry mouth can cause all kind of periodontal, problems. All right, guys, that's if your adult teeth are loose and what you can do about it. Eden's Living TV, all things naturopathic. You can heal. One bite, one thought, one prayer, maybe even one dental hygiene at a time.